Tonight, among the people eligible for the COVID-19 vaccine are those considered medically vulnerable. But what does that really mean, and how often are people rejected for not being medically vulnerable enough? I went searching for answers. Pamela Defina is 73 years old and stressed.
You've received your vaccine?
No, I haven't been able to get it.
Defina has a severe allergy to penicillin, so retail pharmacies have advised she get the COVID-19 shot at a hospital.
And they said, we don't really like to give it to people with that kind of a reaction.
But she says hospitals have told her they're out of supply or are saving what they do have for younger people deemed medically vulnerable. The Florida Hospital Association confirms hospitals are now receiving a very small number of vaccines intended for the medically vulnerable.
Medically vulnerable is a general term, and it means different things to different groups of specialists.
Dr. David Dean is an urgent care doctor on Florida's West Coast.
This is the vaccination consent form.
His office recently started offering the Moderna vaccine to those eligible, including the medically vulnerable.
There were a few people that came in for very minor conditions and just kind of said that they really just want the vaccines, and we did refund them and did not sign the paperwork. But that's really a minority of people.
While the Centers for Disease Control and the state offer some guidance on high-risk populations, ultimately doctors have the final say.
There is some black and white that they said, people with severe heart disease, people with severe diabetes and immune system issues. But then there's some borderlines. So what if someone has really mild asthma? What if someone has allergies, but the allergies could be very severe at times? These are all questionable or subjective decisions that a doctor would have to make.
It's not known if or how many Floridians have been rejected for not being, medically vulnerable enough. The state doesn't track this information, neither do doctors or hospitals.
Really, what will just resolve this whole thing is opening up vaccinations to anyone that wants it at this point.
Which brings us back to Pamela Defina.
I have to have it to protect myself.
A 73-year-old severe allergy sufferer who also beat cancer, but still can't seem to beat the system to get a COVID shot.
I don't understand why.
We're working to try to get Pamela her shot. If you're eligible but still having trouble getting your shot, I want to hear about it. Email me at the address on your screen. Katie LaGrone, WSFL TV.